What are bone spurs? A lot of people have that question. An osteoarthritis, what is it? So there's really two main forms of arthritis: rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is an autoimmune disease where the body kind of attacks its own joints. Osteoarthritis is just wear and tear. I tell everybody, if you live long enough, you're going to break down a little bit in your body. So what happens is oftentimes we'll have a disc space, and this can be in any joint. It doesn't have to be the lower back, but because we're chiropractors, we'll be talking about that today. But you should have normal width in between your bones, and that's the disc. The discs are kind of like if I took an onion and I cut it crossways, popped the center out, and put some jelly in the middle. But they're about 93% water. If you injure these discs and they start dehydrating or shrinking, oftentimes it'll cause some instability. And this can be from something repetitive that you've done through your job, or one-time events like slips and falls, car wrecks, four-wheeler accidents, sports-related injuries. Well, the body hates instability. So anytime a joint becomes unstable, think of a spraining an ankle, and then once you've sprained it, it gets easier to sprain it a second or third time. Just like that can happen in an ankle, it can happen in the spine. Well, over time, the body hates instability, and so because of that, over time, it will start putting down extra calcium on the ligaments that have been torn. And a ligament, all it is just a piece of cloth basically sewn across these bones. It doesn't expand, it doesn't contract. It's pliable, but it does not expand or contract. Its whole job is to keep these bones together. Once you've sprained a joint, that ligament becomes stretched or torn, and so it becomes unstable. So what the body will do over time is it says, look, if you're not going to stabilize it, I'll stabilize it for you. And the way I'm going to do that, I'm just going to throw some extra calcium down on this torn ligament, and I'm going to kind of tack weld it for you. So think of it as like a chain with links in the spine. And if I get my truck stuck and I need somebody to pull me out, they're going to hook a chain in my truck in their vehicle, and they're going to start pulling on it. When they put tension on that chain, if that chain's going to break, it's going to break at its weakest link. So the body knows there's a weak link there, and just like I could come in with a welding rod and tack weld a weak link to a strong link to strengthen my chain, I lose motion, but I do strengthen those joints. Same thing here. So anytime the body has a unstable joint, it'll throw extra calcium down on those torn ligaments, trying to stabilize that joint. The problem is it decreases decreases motion and increases pain. And that's why people have osteoarthritis when they wake up in the morning real stiff and achy, and once they kind of get moving, they feel better. Same principle with the spine here. So anytime you lose movement, you increase pain. As chiropractors, we go in and reestablish motion into that joint. Most of these bone spurs, you cannot take them out or off unless it's just horrible and they're doing a joint replacement.